Welcome to the Behind the Counter with NJSHP, a podcast for pharmacy students where we interview current pharmacists and talk about topics in the pharmacy world. So I'm Connie. I'm a P1. I'm the Public Relations Projects Chair at Rutgers NJSHP.
Hey, I'm Shiloh. I'm also P1, and I'm the co-chair with Connie for the public relations at NJSHP.
So today we're going to be interviewing Dr. Jennifer Sternbach. She's currently the Corporate Assistant Vice President of Clinical Pharmacy Services at Robert Wood Johnson Barnabas Health and the President-Elect of NJSHP, who currently works with pharmacists to coordinate their needs with the capabilities of the corporate side of the health system. So if you want to take a moment to also introduce yourself.
Hi, I'm Jen Sternbach. I am the Corporate AVP for Clinical Pharmacy Services. I'm really excited to join you guys today. Thanks for having me.
Nice. Brief summary or quick overview of how you got to where you are now, because it's a very interesting story.
And you want me to do it briefly? Okay.
You try your best.
It's long, it's long and complicated, but we're gonna try. So I graduated from Rutgers in 2001. I actually was the second to last class to have an option to do the PharmD. I did, for credit, get into the PharmD program, but I opted to actually not pursue the PharmD. So I graduated in May of 2001, and in September of 2001, I boarded a plane to Belgium. And I spent 2 years there studying business. It was Boston University used to have a campus in Brussels. And so you could do an American accredited degree, also qualify for student loans, which helped fund that excursion. And so I have a master's in multinational commerce and a diploma in finance. And then I came back home, and I guess it was 2003. And I was trying to find some work. And I had a friend from pharmacy school who said, come on, he was working at Pathmark at that time, who said, come on, come be per diem at Pathmark. So I did, and I said I would stay for 6 months, and I stayed for like 6 years. So I worked a few years there, obviously, in retail. I was a supervising pharmacist for one of the stores. I ended up, a few different places with them. At a certain point, I realized I was going to need my PharmD again. I was actually interested, which gets ironic in my current role, in ambulatory care at that point. And so I decided to go back to school to do my PharmD, which the University of Florida had a working professional program. And so I applied to that, and I needed, as a part of my schoolwork, needed more clinical access to patients than retail was providing me. So I had to go find work at a hospital. I was lucky that Clara Moss in Belleville had an affiliation agreement with the college. And so I reached out to their coordinator and said, hey, can I volunteer to do work? So I started there, and they were just kind of starting out their clinical program. They had just hired their first resident. And so they said to me, would you be interested in working like a per diem part-time clinically? And so I took that opportunity. So I had the retail job, and I had the hospital job, and I had school, but it was really great experience. And I was really lucky that actually the hospital was about a half a mile from the store I was working at that point. So I could, work at the hospital in the morning and then go to work at retail for the, evening, like a 7 to 1 and 1 to 9 type of thing. So it was convenient. That was nice. When I finished my PharmD, I had fallen in love with hospital pharmacy. And so I was, interested in pursuing a position there. And so the director of pharmacy was able to offer me a position actually as a supervisor, which was really, in my opinion, at that point, a really big stretch because I had not really spent that much time in hospital. But thankfully, you will meet people in your career who tap you on the shoulder and see things that you maybe don't see. And you should jump, by the way. And so I was like, okay, let's try this. So I became the supervisor there for a few years. After that, moved to clinical coordinator for a few years, got the opportunity to work as the residency program director, which is a really great passion of mine. And then there was an opportunity to go to corporate. And so corporate doesn't necessarily always have, it's not a lot of doors. And so when I saw that door, it was a great opportunity. I said, let me go try this for a little while. And I started as the corporate clinical coordinator in 2017. So I was at Clara from 2007 to 2017, and then became the director of clinical services and now the assistant vice president.
Yeah, it seems like you had a lot of different pathways leading up to your career now. And is there a reason why you didn't want to pursue PharmD at the time before like getting into like the per diem and everything?
I wasn't sure exactly what I wanted to do with it, and like with pharmacy. And I have dyslexia, and so the learning disabilities make pharmacy a tough field, right? Dyslexia, your brain doesn't kind of move in a linear fashion. It's kind of all over the place. And pharmacy is a very linear type of a study. So I wasn't exactly sure what I wanted to do. I was struggling academically, and I just, I kind of like, maybe this isn't right for me right now.
Just circling back to your role right now, can you give like just like an explanation of like what exactly do you do as a AVP?
So I have oversight then of clinical pharmacy services. What I'm overall trying to do is help to ensure that pharmacy is well positioned in our organization, that we are working to the top of our license, that we are creating an environment where people want to train, where it be students, where it be residents. We're creating an environment where people want to work, right? What I try to do is to kind of set our goals and our path for what pharmacy is going to do. At the same point, I have amazingly talented people, whether it be my clinical coordinators, I say mine, even though they're not mine, the clinical coordinators or the assistant directors of clinical services, to our clinical specialists, right? So between all of our service lines, we have some highly amazing clinical specialists. And what the other part I'm trying to do is, how do I remove the barriers that are in their way on a daily basis so they can do what they are so talented at? So I shouldn't at this point in my career anymore be standing at a bedside. But, they are so incredibly talented. And so if I can remove a barrier, and they can be all kinds of different things, in order to let them do what they need to do, then I've been effective. Because that's how that goes back to the creation of the environment that everybody wants to work in. So the services and the way that we practice pharmacy at RWJ is what's going to make people want to come work with us, and they want us to be part of that team. My job is a little bit of like, what are we doing 3 to 5 years from now? And also, what are our problems today? And how do I fix that? So it can be something as like Epic's annoying us in some way, and I got to go try to figure out what that conversation looks like. Or strategically, how do we make sure that we're well positioned in the organization?
So talking about those barriers, and I know you kind of touched upon them, what would be some of the challenges working in your career right now, or also maybe what are the positives that come out with it?
Well, the positives are, just the great people. So anytime I hear a story about something we did in pharmacy services to improve a patient's care, to improve the outcomes for patients, to improve medication safety, any of those things are the positives. And if I had any role in that, then I'm excited. One of the great things of being with the organization as long as I have is that I've watched so many of our residents become specialists, become managers. So like we were just at ASHP this week, right? And so, standing at our residency showcase, looking around, seeing how many former residents are there. Or my other favorite, especially at mid-year, is when former residents come visit us and I get to see how they're doing, and they check in. So that's like a total personal favorite of mine. So those are all the positives, to just see all the great things that we can do. Challenges are probably more associated to just kind of healthcare in general. Healthcare is a very expensive field, right? It's one of the largest expenditures that we have from an economic standpoint. So there's a lot of pressure to reduce financial expenses. That comes at me with, hey, how do we align drug utilization to make sure we're controlling costs to positions? I would love to hire every pharmacist that there is possible, but that's not something that I can always do. So how do we demonstrate, the values, the reason that we do need to have those positions, and how to make things work when sometimes there aren't resources. I think pharmacists are really good at that, too good at that, of saying, I have a mentor who used to say, we know how to make peanut butter with no peanuts. And so we're really good at taking those challenging resources and making something happen.
One thing you really liked about your job was the people you work with, but has there ever been a challenge where the people you work with can be kind of be a hindrance or a barrier?
Well, we're humans.
Yeah.
So I think that there's always challenges, right? And that's just personalities. One of the things that I like to work with the residents on is the ability to have crucial conversations, right? I work with lots of different disciplines across the organization. So I'll have a tough doctor that I have to work with. I mean, every one of my colleagues has a tough doctor that they have to work with. It's really not different than when even I was at the bedside. It's just that the scope of it is different, right? So instead of when I was at the bedside and I would be working with a doctor or a nurse trying to make sure that we got the outcome we wanted is the exact same thing I do now. It's just that now it might be a chief medical officer or a chief nursing officer. And it's not that same, but the combination of people is the same. So I think it's a lot of the same skills of trying to find what's the common ground, what do we need to accomplish. Sometimes it's a little bit of setting like, okay, maybe I do have to let this part go, but I'm not going to let that part go because that's the one that's much more important. So setting those goals and having those tough conversations is something that's part of everyday pharmacist practice. I just kind of do it on with different people.
I think sometimes working with harder workers is definitely a challenge, but it's actually a really good strategy that you use. And I guess focusing more on your corporate side or the corporate pharmacy division, would you say like interaction with those people is sort of different than being in the hospital setting?
I think it's a lot of the same, so the team again has a similar goals. If you're in one of the facilities or the local sites, we're all around the same idea of advancing pharmacy practice, medication safety, regulatory requirements that we have to make. Pharmacy is one of the most regulated fields that there is. So trying to make sure that we're always doing what we have to there, as well as what we need to for our patients, as well as what we need to do for our other providers. Pharmacy sits in a unique space that our customers are everything from the patients to the doctors to the nurses. And so we have to figure out. And so I think, again, it's a lot of the same. It's just, a combination of who am I talking to? So, from physician leadership, if I go to the chief medical officer, so he and I can have a conversation about, maybe a local challenge or things like that, because I know he's very motivated and also set on making sure that the health system is doing. We have very similar intentions, right? But his is coming from a different perspective. And the same with our nursing officers. They want to make sure that we're offering the best care and that we're creating an environment where nurses are safe to practice and all that. And it's not any different than I'm trying to do. So that helps a lot when you have this similar teams with similar intents.
Okay. Kind of curious. You mentioned like a local challenge. Can you give like a specific example of a project you did of like a challenge, if possible?
I think the most recent project that we've all engaged on has been the implementation of Epic. So the health system started, its journey to having one unified EHR. I think we had about 9 different systems. It's really hard to practice across a care continuum when you can't see what other people are doing. So probably the biggest journey that the health system has been on, and it started in 2020, so it was super fun to kind of overlap some of that with COVID, has been building and implementing and installing and now supporting, because we just had our last wave at the end of September, Epic, and figuring out how we all practice now, when everything, and Epic's an extremely complicated and powerful system. And so making sure that we all figure out how we do this together with a lot of data, which is really cool too. So I'd probably say that's been the biggest challenge because, making sure that pharmacy is represented in the right conversations. Epic has a lot of workflows from an operations side in terms of how you have to do things. We're still having a lot of conversations about how do we all do things the same way, right? So that way it's supported in Epic. That's been a tough one. So and it's an ongoing journey. I don't think we're there. I think what's nice is that we're no longer implementing it. So a lot of the time we'd be like, okay, we finished doing this and now let's talk about all these issues we have. And then we'd be like, just be getting into it. And then it'd be like, hold on, we got to go take 3 more hospitals live. So we can't, and then we got to take care of their immediate problems. And then we'll come back again and we'll talk about it. So we're looking at a roadmap, or we're looking at a space of time now where we don't have an implementation for a while. Well, we don't have any more unless somebody else comes into the health system. And so now it's like how are we building and how are we using and how are we working the system that is best for us?
Working with technology is always a struggle.
Well, and it keeps changing. I I must have been in 12 different conversations last week or this week. Everything's a blur with midyear, about AI. And I'm like, please, I just need, to handle today. I can't think about AI.
Well, overall, it sounds pretty epic, I guess. Sorry, that was so lame.
It's a tough name. You got to do that.
Yeah. So we talked a lot about like your tasks, and you kind of mentioned about all the roles you have throughout the day. Would you be able to like break it down what your day-to-day kind of looks like working for RWJ?
I can tell you that no 2 days are the same. It's a mix. So obviously I spend a lot of time on meetings, talking to different colleagues around the system if they're having a challenge or just want to discuss an issue or what do we think our strategy is going to be on something. So a combination of phone calls, meetings, and things like that. And then hopefully somewhere in the middle of the day, I get some downtime or get some ability to actually work on the projects that I need to work on in order to make sure that we're getting the things done that we need to. That's probably the biggest challenge of my day, is that I'll be on meetings all day and then I'm like, wait, when am I supposed to actually do the work I'm supposed to do?
How do you kind of keep track of everything?
I'm just going to take a second to know that if any of our residents listen to this or anybody who has spent time with me is probably just laughing right now at this point. I have to keep a lot of different to-do lists. And I try to keep them electronically because, one of the things that I teach the residents, which is why they laugh at me, that our brains are really bad places to store information. So, you're only going to recall about, 8 to 10 things, and you're probably recalling the majority of that at the most inopportune moments, like when you're in the shower. So what I really try to do is that I try to just keep to-do lists, and then I kind of set an intention every day of, okay, today you're going to do this, this, and this. And sometimes on the days where it's just a straight block of meetings, sometimes my intention is just, I'm going to be super present today on the meetings and do the things that I need to do. Because otherwise, if I try to say I'm going to cover these 3 different writing things or whatever I need to do, and I don't get to it, then at the end of the day, I just feel bad. And so I have to try to balance that what I can get done in a day, I'm not good at that. I try to set really unrealistic expectations and what needs to be done. But for the most part, it's making sure I keep to-do lists and then filter through them to say, okay, today you're going to work on this, this, and this. Looking ahead, what's next week's meetings? What's the week after that? What do I need to get done? What are those deliverables? I have to move a lot of things through different groups. So one of the things, for example, that I have oversight of is the system formulary committee. So when we're looking at adding items to the formulary, what's the service line? Who are the SMEs that I need to talk to about what our strategy is going to be around that drug? But, that starts ahead of it that I have to make sure I have a monograph from our drug info center. Then I have to make sure that what I think, and that sometimes is a conversation with my corporate team. It's sometimes a conversation with the local teams. What does pharmacy think our best strategy is for this drug? Then I got to go talk to the service lines and say, what do you want to do? Here's what we think about this drug, and have that all done. And those meetings happen. This year we had 6 of them. Next year we have 10 of them, and so it's a constant rolling thing. So kind of making, where am I with this project? Where is it? Things like that.
Yeah. You also kind of mentioned getting a new drug implemented. It seems like a big challenge, but for our pharmacists in the ambulatory setting, what's a big challenge you see happening with them? And I guess like in in this current age?
So we're in New Jersey, and the biggest challenge that we have is billing for pharmacy services. So pharmacists not being seen as providers. You know, a lot of states have passed state level regulations and things like that because we don't have it at a federal level yet. And so I'd probably say that is our biggest challenge, because then the value has to be proposed differently. Everybody, I can almost generically say that everybody loves pharmacists and thinks they're very valuable. But at the end of the day, in order to get positions, there has to be a financial component to it, right? You have to demonstrate and show, and that's not just pharmacy, right? That's every position, you know, because it is a business. And so being able to demonstrate that. So I have to find ways, or I have found ways over the years to demonstrate value, but it would be so much easier if we could just bill for our services, right? And then you could say they're going to see X amount of patients, and this is going to be the revenue that's associated to them. So that's probably, that would be my biggest ambulatory challenge, in that, you know, we don't have that.
Okay, I guess also another question I have is regarding the IV shortage, because that's something you talked about. So I'm just kind of curious, like what's the situation like now?
It's looking better. You know, Baxter's getting more of their service, their lines back up, you know, their production lines and things like that. You know, for better or worse, pharmacy's really good at shortages because there's something that's been happening for a long time, right? I can't even think about how many years ago it was Hospira at the time when we lost that, like, you know, there was an issue at that plant, and like it's a constant kind of rolling shortage management that so pharmacy's very used to that, like, okay, here we go, we got to pivot. For the most part, we were not directly impacted because of the shortage had to do a lot more with large volumes. So the liters and the 500s, we got into it for the 250s. Current challenges, we're getting imported fluids, and so may not have barcodes. They're in an entirely different language. Ports look different, things like that look different. So that's kind of the current, but overall, we're kind of holding, you know, our own. We go through waves, right? We get our trucks and we look okay, we don't get our trucks and we don't look okay, you know, and things like that. You know, we anticipate that we've got a couple more months, but we'll be okay.
So how was mid-year?
Well, you know, the slogan for this year was "There's nothing like it," which was a very accurate slogan. I mean, partially because it's New Orleans, which is exciting. New Orleans mid-year overall, I will say, is really overwhelming. It's a lot of people, but it's also a really great opportunity to network and talk to people. So I'm just going to put this blanketly to any students who listen. You need to make sure that you're really taking that opportunity to talk to people, because there's all kinds of people there, you know? So you'll be sitting in a session and you could be sitting next to the chief pharmacy officer from some very large health system, you know? And so I really hope that people take the opportunity to talk and network and create those things, because that's what I love about mid-year, is that I think this was my 12th or 13th mid-year in a row that I've been to. And, you know, I've known a lot of people. So to me, it's a lot of catch up, you know, oh my gosh, I haven't seen you in a year. How are you? Blah, blah, blah. There's like 15 text messages that go out the week before, like, are you going to be at mid-year? Let's catch up. And so I basically feel like I just spend my whole time catching up with people and talking, but it's those collaborations that are so valuable.
Kind of curious now, like, you said it's been mid-year for like 12, 13 years. How has mid-year changed? And from your perspective, how have kind of like pharmacists changed, or like residents changed over the years?
Know that mid-year has changed as much, because at the end of the day, it is the clinical meeting, and so you're going to always have a fantastic clinical sessions to attend, to learn from. It's got a large focus on residency, so you're going to have the showcases and the posters and the research and all those types of things. So I wouldn't say mid-year per se has changed. I know that the way I attend mid-year has changed over the years. You know, when I was first starting, I was you go into all the clinical sessions because I was a new clinical pharmacist and what did I need to learn and, things like that. So I was always trying to tap into that. As I became a clinical coordinator and got involved with the residency program, it was let me go attend to every session that there is about residency programming, like so that way I can learn more about how to do it. I've had the opportunity to speak at midyear, and that's a cool opportunity. It's totally terrifying too, but it's a nice thing. So, but that was how I did it then. As I moved higher into administration, then it was like, oh, let me go attend these joint commission sessions. Let me go attend these leadership sessions and things like that. When we started our PGY2 in ambulatory care, I spent a lot more time in PPS than I had ever spent. And so I think that's what's changed over the years for me. And even this year with NJSHP responsibilities, that also meant, oh, let me go check out the state affiliate this and attend different sessions and stuff like that to learn more and connect more there.
Yeah. And you just mentioned like NJSHP kind of, I guess firstly, why did you join NJSHP? And also, what's been your experience being part of NJSHP, I guess?
So I've been a member of NJSHP for probably as long as I've been in hospital pharmacy, but I guess it was 2+ years ago. Time is a really weird thing for me. So I'm not always good at like anchoring where things happened.
That's fair.
So they were looking to create a social media director position. And so I heard about it at the NJSHP annual meeting. And so at that point, within my job at RWJ, I was responsible for our social media pages. And so looking at that opportunity for NJSHP, I said, wow, there's just this crazy amounts of potential to talk about what the profession of pharmacy is, right? And to get more information out there and get to like increasing awareness and things like that to help our profession. And so applied for the position of social media director and was lucky enough to get it. And that really changed my involvement in the society. And so that obviously put me on the board and things to be able to listen to the meetings differently, interact differently, understand what they were trying to do from an advocacy standpoint, from a membership support standpoint, from all kinds of things. And it really was so exciting that when I was approached to say, hey, do you want to consider running for president? I was like, yeah, actually, I think I kind of do. And so, that kind of led me to where I am today. I think it kind of tracks with my career path, right? Different opportunities present itself, and then I'm like, oh, let me go try that and see what happens. I got to tell you, though, it hasn't steered me wrong yet. So I think when you find things that you are passionate about, and interest you. And obviously, I care highly for the profession of pharmacy, and it's what I've dedicated my career to. And anything that can be done to advance pharmacy, I want to be a part of it. And so whether that be NJSHP at a state level, whether that be ASHP at a national level, whether it be my organization at a local level, I want to be a part of that.
Thank you so much for your time. And I really like this conversation with you. I definitely learned a lot and just very insightful. It was awesome listening to you talk. And so, yeah, for our viewers at home, that's it for this episode. And see you guys next time on the Behind the Counter podcast.